Hi, I'm Dr. Matt Lasorsa, and I want to introduce you to Osseopure. This is a new dental implant company, and if you're into implant dentistry, I think you're going to be excited about a lot of things we're going to have coming out. We're going to be making 5 different lines of implants, okay? Let's start small. Ball and square implants, mini implants, we're going to be using those for dentures, okay? Or maybe very small lateral teeth, something like that. But you'll have your traditional ball and square for removable appliances like dentures. Okay, that's the smallest one. The flagship of the company is going to be these pilaster implants. The pilaster implant is a one-piece implant that has a built-in MUA and a screw channel to seat your restorations. So if you look behind me, one option is a removable appliance. You place your pilaster implants, and there's an abutment for a removable appliance. It's called the equator abutment, and that will screw onto the platform of the implant, and it serves like a locator. Okay, it's a removable appliance. I'll talk about the restorative materials in a minute, but that's your removable option with the pilasters. The nice thing about the pilasters is if you put these in, and the patient changes their mind and they want to do a fixed appliance instead of a removable appliance, no problem. Okay, if you have enough implants in place, these are really what the pilasters were geared for. Again, it's a one-piece implant tissue level with a screw channel. So you can screw your full arch restoration directly to the platform of the implant. No need for an MUA, no need for a tie base, no need for a screw chain, okay? Because of that, you don't have to do a whole lot of bone reduction. Okay, if you want to do FP1, you probably don't have to do any bone reduction. But even if you're doing FP3, it's minimal because you don't need very much space, okay? Also, because we're not using tie base or any kind of screw channel, you don't need that much vertical for the restoration, okay? So it's a no-brainer. It saves cost, it saves time, and you don't have to crank the bone down on the patient. Even for single tooth implants or multiple tooth implants, okay, you can use this tissue level implant and have the restoration directly screwed to it. Now, if it's a single unit crown, you do have to use a tie base. But if it's multiple unit, it's the same concept as the All-on-X. You just screw it down to the implant platform. One of the first questions I get about the pilaster implants is when dentists see this picture, they say, yeah, but you're showing all those implants parallel. A lot of times I can't get my implants parallel, or because of the sinus structure or the metal foramen, I can't make them parallel. Well, that's not true, okay? With the pilaster implant, because of the connection, your implants can be 90 degrees divergent, okay? Nobody wants to place their implants 90 degrees divergent, but even with 90 degrees, okay, you can still seat the bridge over there passively. So that's a big advantage, that you don't have to have these MUAs to correct the angle. Okay, you can place it at any angle you want. We'll still be able to restore them. Obviously, you have to be conscious of where your axis is going to be, because you don't want it to come out to the facial. But other than that, it doesn't matter if they're parallel or not. We can passively seat your bridge over. Now, for a lot of you out there, some people don't like the idea of a one-piece implant. Mostly oral surgeons, periodontists, nothing against them, but they were trained on having a traditional implant that's buried, to have a healing cap or a cover screw, and then to uncover it, or to load it with a custom abutment or an MUA or what have you. So we are making a couple lines of two-piece implants. The first one that's available right now is called the Intrahex, or the hexagon implant. This is a traditional two-piece implant. It's going to have the same aggressive threads and the same surface treatment as all our other implants. These are MegaGen compatible, MegaGen AnyRidge. So if any of you out there are MegaGen users, you don't have to change your surgical kit, you don't have to change your prosthetic kit. These will all have the same connection. Okay, so that is available right now. What I don't have as a catalog, because it's not finished yet, is another line of two-piece implants we're going to have, and that's going to be called the hexalobe implants. The hexalobe implants are going to be Straumann compatible. Same thing, same threads, same surface treatment, but the connection is going to be Straumann compatible. So if you're a Straumann user, you can get in my opinion, a better implant with a more bioactive surface and more aggressive threads than a Straumann, but not change your surgical kit, not change your prosthetic kit. These are the two-piece implants we're going to be producing. We'll have custom abutments, stock abutments, MUAs. The MUAs will be typical that they'll have straight MUAs, 17-degree MUAs, and 30-degree MUAs. So you're not losing anything by going to Osseopure implants. You're going to have all the same options. One other implant line that we're going to develop is a traditional one-piece implant with a crown and bridge abutment. So similar to some of the other brands I'm sure you've used in the past, so the old Interlock one piece that had a crown and bridge abutment, Osseopure is going to make that as well. Honestly, I don't use those very much because the abutment head tends to be kind of long and you need a lot of vertical clearance, but they're nice to use if some people are just missing one tooth, maybe congenitally missing, or maybe they had an accident, they're just missing one tooth, the rest of the teeth are healthy, they're probably not ever going to go to a full arch, so that one piece is an economical and easy way to restore that one tooth. Let's talk about the restorative materials we're going to be using to restore those implants. Whether it's a removable appliance or a fixed appliance, the substructure is going to be this Xantex material. Xantex is a fiber reinforced resin that's very strong and very useful, okay? You can't break it, all right? This will be the substructure to give strength to the arch. So we can make the substructure and make a denture over this with acrylic. We could make a fixed arch with this and use zirconia as our finished material. We can use this material that is my favorite called Amberino. It's very aesthetic. It's a nano ceramic with a little bit of composite, so it's repairable. It's relinable. It's repairable. If a patient chips a tooth, you can fix it intraorally just with some composite. Or if they have a problem later, you can just mill out another one. So you can use the Xantex substructure to do a removable appliance with acrylic, fixed appliance with Amberino, with zirconia, with lithium disilicate, whatever you want. Okay, it's very useful. It bonds to composite, it bonds to acrylic. So if it's a removable appliance, you can reline it, fixed appliance, and they chip, their Amberino, you can fix it with composite. Okay, very light, very strong. The Xantex itself is going to have a lifetime warranty. So if the patient breaks it or something happens, we'll mill out another one for you. We want things to last long term. We want to work with our dentists long term. Okay, we use digital workflow. We have scan bodies for all our implants. We use a Trio scanner and a 3D printer so we can mill out our temporaries the same day. But we can also do it with analog. If you don't have a scanner and a printer in your office, we also have analogs to do things with impressions and typical. So we can use digital workflow. We use a Trio scanner. If you have scanners and 3D printers in your office, we would just give you the scan bodies and we can have the arch printed out, in about 30 minutes. We're also going to have scannable healing abutments that's coming. So if you place your implants, you can just scan the healing abutment, and then from there we can restore the implant. Okay, well, what makes us different than some of the other implant companies out there or the current implant system you're using? Well, it's pretty versatile, right? We're gonna have 5 different lines of implants. If you're doing a full arch case, and in the anterior you have long, thin bone, you could place the pilaster towards the posterior. If your bone gets short or you're in the maxilla and the sinus drops low, well, you can switch to our 2-piece, use a short, wide implant and put an MUA on it. Once you put that MUA on it, it's the same connection as the pilaster, so prosthetically they all become the same, okay? Again, we're gonna have 2 lines. One is Straumann compatible, one is MegaGen compatible. We're gonna have a traditional one-piece with a crown and bridge abutment on. We're gonna have mini implants with a ball and square. And of course, we're going to have our flagship, the pilaster, the one-piece implant that has a built-in MUA and screw channel. The surgical kit's going to be pretty straightforward. It's going to have all the drivers all in one kit, all the osteotomy burrs in one kit, so you really only need one kit for the surgery and the prosthetics. So it'll be pretty easy for your staff to keep track of. As far as pricing, don't quote me on this, but I think when you start out, we're going to give we're going to give a package that 6 implants, the temporary bridge, the final milled bridge, the restorative material of your choice, all in for about $29.95, okay? It's been about a 2-year process to get FDA approval. FDA approval should be in by the end of 2025. So we're gonna have multiple courses in various locations in 2026. Towards the spring, most of the meetings will be in Buffalo, New York. Buffalo, New York is gonna be all the manufacturing, the lab, the lecture, the surgical suites. We're gonna do live surgeries. You're gonna see the labs milling out the arches. You're gonna see the manufacturing and the sterilizing of the implants themselves all in one facility. To my knowledge, there's not an implant company out there that has the manufacturing in the US, the lab on site, the educational facility on site, and surgical clinic that we can teach live surgery on site. Maybe I'm wrong, but to my knowledge, we're the only ones that have it all. This isn't a new company with a bunch of new players. These are all veteran players that came together as partners for one company. And I think very quickly we're going to be a household name and a major player in the dental implant market. So if you're interested in learning more about Osseopure dental implants, click the link below or contact us, and we will reply very, very quickly about some of our meetings coming up in 2026, our live surgeries, any events we're having, and any questions you may have.